Wisconsin is on track to implement changes to its BadgerCare Plus program on February 1st of 2020. This all comes from a Section 1115 demonstration waiver that our previous administration in Wisconsin submitted to the federal government to make changes to its BadgerCare Plus program. It originally wanted changes that looked like things adding work requirements, drug testing, premiums to its BadgerCare program for adults without dependent children in the home. Some of those pieces were approved, drug testing was not, and the implementation is now moving forward for a couple of those approved pieces. Now, the 1115 demonstration waivers allow states to try to prove they can do their Medicaid program better than the federal standard. It's a question whether these changes will actually improve the program, since they do add some restrictions to eligibility. Let's take a quick look at the changes that are on track to be implemented on February 1st. The first one is monthly premiums. If you are an adult without dependent children in the home, also called a childless adult, and you are enrolled in BadgerCare Plus and you are between 50% and 100% of the federal poverty level, as of February 1st, 2020, a premium will attach to your BadgerCare Plus. Now that's about $8 a month, which can be reduced if you follow through with some of the healthy behavior incentives that the program also will include. Those premiums can be paid monthly or all at once in a lump sum. There is also a new feature that is an emergency room copay for non-emergent use of the emergency room. That is an $8 copay if your use of the emergency room was determined to be for something that was not an emergency. That attaches to that childless adult population February 1st as well. The third program that's on track to be implemented is a health risk assessment that includes a health behavior incentive. This is a mandatory assessment that focuses first on substance use disorders. Once you go through that screening, there is an optional portion of a health screening. Successful completion of this is one of those factors that could reduce the premium amount owed if you do go through these hoops that get you into the door to your BadgerCare Plus. Now, like we said, work requirements was delayed. There is no drug testing that will be implemented, and things like full coverage of residential substance use disorders, also included in that waiver, will not be implemented on the same timeline. We will keep you posted should any of that change anytime soon. Now, we are bringing you this update because there was a possibility that this timeline would be disrupted because of Wisconsin's process implemented through its last lame duck legislative session that said Wisconsin's Joint Finance Committee gets 14 days to review the implementation plan of this waiver. So the Department of Health Services sent their plan to the Joint Finance Committee. They went through what was called their passive review. No one objected to the plan, so now we are back on track for the original timeline. And that original timeline means that notices will be sent to individuals impacted by these changes starting November 1st of 2019. The changes then will start taking effect, like we said, February 1st of 2020. If you want to read up on that letter that went through the Joint Finance Committee that includes that timeline and that implementation plan, we do link to that in the description below. For more information on BadgerCare Plus and the rules of eligibility and your responsibilities, you can find us at healthwatchwisconsin.org.